Good evening, and thank you very much for the opportunity to discuss with you biophotonics applications of something we call gas and scattering media absorption spectroscopy. What awesome sight to see this terrific audience here tonight. It's a tremendous development of the area during the 35 years or so we were involved in biophotonics. It's just sweeping off the feet. This particular field that we are addressing here, we call Gauss Mouse. And what is it all about? It's a high-resolution laser spectroscopic technique where we investigate strongly scattering media such as biological tissue. In transmission, you can see then that if we scan such a laser, we will see the very broad absorption imprint of the bulk media, basically solid-state signals typically of considerable width. But if the light passes a gas pore or a cavity, there is a very sharp needle stitch that can be observed. We can do that in transmission or in backscattering. And where would we find these situations? In all types of materials, like construction materials, ceramics, woods, and so on, and talking more about biophotonics in pharmaceutical preparations, in foodstuffs, in packages, and various areas of biomedicine. Monitoring the concentration of gas normally involves the Berlin-Bourgeon law, but there is a problem here, of course, since there is no well-defined path length. So how do we handle that to get out the concentration? Well, we can normalize on a water vapor because it's well known its concentration just given by the temperature. You can see collaborators here at the bottom, red ones, medical doctors, and the blue ones more towards the technical and physics side. The GASMAS project came along through a long-time development in the intersection of measurements of trace gases in the atmosphere. Stuff we did for decades, actually. Differential absorption LiDAR at kilometer range, where backscattering from particles is used, and then we see the concentration by spectroscopy of the gas in between the particles. In Gauss Mouse, to the right, we do basically the same thing, but now it's the centimeter scale. And the scattering now comes from the gas-filled pores that might be in there. And we probe the gas contents inside these pores and not in the surrounding medium. Everything else is the same as a typical cross-disciplinary aspect. Here we show the very well-known broadband distribution of major constituents in biophotonics. Zooming in on the optical window around 760, we can see the extremely sharp signals due to the molecular oxygen, the PNR branches. And we really talk about sharp lines here. We have to hit them on the 6 digit correctly. And this we do with these techniques from environmental monitoring of gases pollutants, basically. And the imprints are just a fraction of a per mil frequently of the total gas coming out. But by sensitive lock-in wavelength modulation spectroscopy, we can pick them out. As a pedagogical example, we can here consider monitoring of a pharmaceutical tablet with a size of a few millimeters. We collaborate with AstraZeneca quite a lot. They are interested in porosity studies and delayed release for obvious reasons. And to the right in the picture, we can see this tablet, which is a few millimeters. We launch picosecond pulses into that, and they arrive photons at the detector with a delay. It looks like the tablet is 100 times larger than it is due to this massive multiple scattering. To the left, you can instead see the GASMAS version of the same experiment, where the VCSEL tunes over the narrow absorption line, a single line of oxygen, and we see the signals first, second, and higher derivatives with quite good signal to noise. What else? Food monitoring is of great interest, and food safety and freshness of great concern, not the least in China, of course. Most food is not packaged in normal air. It's a modified atmosphere. We want low oxygen for a longer shelf life and quality, replacing the normal air with nitrogen and the CO2. And it's possible by a Gauss Mouse here to penetrate and go non-invasively through the cartoon. As you see to the right, these are experiments we did over in China. Oxygen and water vapor monitoring, and we follow here 10 packages, milk packages, over the time, and passing the best before date, we see that the oxygen develops very differently in these identical packages due to different ceilings, different aspects. And we have a large European project now where we study this industrially, because everything is packed, and we monitor the Gauss Mouse, each individual package, and kick them off the conveyor belt if they don't fulfill the quality criterion. Eggs, important food stuff, clearly. It's interesting and important to know how fresh they are. And that can be done by monitoring the size of the air cell inside. We do that with Gauss Mouse, as you can see in the setup here. And in the lower left, you can see how the gas cell increases in size over a 3-week period. In fertilized eggs, there are 3 weeks in incubation times. It's of course important for the chicken to have access to oxygen. They don't have the umbilical like people, and from where do they get the oxygen? By diffusion through the egg shell. And you can see how we can measure non-intrusively here the diffusion of the oxygen through that. It takes 10 minutes. And in the lower right, you see actually the development of the concentration of oxygen available over the 3 weeks of incubation. It becomes very low, as seen in the green curve. So it's a good reason for the chick to come out, not for other reasons. And then Katarina will take some pure biophotonics aspects and continue.
Osteoarthrosis with pain due to carpet degeneration, in particular after a fracture, is quite common. But how to diagnose early and how to make a decision for surgical intervention? Our hypothesis was that there is a development of gas pores inside the degrading bone, and our first in vitro clinical trial really showed that this is indeed true. And we also in another study showed that there is much less gas in non-osteoarthrosis bone. For in vivo monitoring, it would of course be beneficial to add laser Doppler imaging, as the disease is also associated with impaired blood flow. And this addition comes for free with the equipment that we use. A second application of Gauss Mouse is in sinusitis, a very common disease. And here the challenge is to classify the reason of the infection, whether it's a virus or a bacteria, as the treatment, of course, should be quite different depending on the genus. At the first glance, the oxygen signal is quite different for the left and the right side, but after normalization on known water concentration, the unknown path lengths can be eliminated, and both sinuses are seen to contain normal oxygen concentration. Also, the conductivity of the channels can be monitored by flushing the nose with nitrogen, which is seen to displace the oxygen. Both these aspects, which are very important for the decision of the therapy, can be detected by the Gauss Mouse technique. In a clinical trial of 40 patients, we could first of all see that our technique based on line is equally good for detecting sinus problems as computerized tomography based on ionizing radiation, which of course is good news per se. Here we have plotted the oxygen versus a water vapor signal, and they should scale along the diagonal for healthy sinuses. However, we also observed small gas volumes interpreted as replacement of gas by fluid, such as pus. Also, we observed cases with comparatively large volumes but low in oxygen due to blocked channels. A third indication is for the very common childhood infection, the ear infection. Together with sinusitis I just discussed, a serious candidate for inducing antibiotic resistance, which is a worldwide ticking bomb actually to all of us. Due to unnecessary antibiotic medication already now in Asia and in particular in China, first and second line antibiotics are inefficient. The reason why small kids get this infection is the anatomy of their ear-to-nose channel, which is horizontal, and the stagnation of fluid can easily happen. This anatomy changes with age, as we can see. We have integrated reflection monitoring for objectively defining the redness of the eardrum, as well as the oxygen content behind the eardrum in the middle ear, so far in phantom experiments. But we are now integrating these two techniques for developing a good clinical equipment. A fourth application is monitoring the oxygen content in the lungs of small, prematurely born babies and infants. Due to lack of surfactant outlining the small alveoli, the total saturation is low, with the risk to the underdeveloped organs to take damage, in particular the brain. Conventionally, the follow-up of medication to these small kids is based on X-ray imaging, which of course should be avoided. The goal for us is to bring GASMAS to a cot-side 24-hour surveillance monitoring of the lung function, avoiding damaging X-rays. And we are now involved in a large European project to technically develop this further. We have published quite a number of papers on various aspects of GASMAS, and for more information, you can also consult these review papers. Thank you so much.